We are going to talk about glutathione deficiency and increased risk of death from COVID-19 infection. If your body has low level of glutathione and if you get COVID infection or say any other infection, then there is increased chance of you dying from that infection. Glutathione is the most abundant molecular weight antioxidant of our body and it has several functions to perform. It helps in detoxification of foreign bodies as well as protein foldings. It helps in regeneration of vitamin E and vitamin C, and both are very powerful antioxidant. Vitamin E is a fat soluble antioxidant that protects our cell from oxidative stress, and vitamin C is very important to boost our immune system. Glutathione also enhances the mitochondrial function. See, mitochondria is the powerhouse of cell because it helps to generate ATP. So it is seen that if you have deficiency of glutathione, then your mitochondria cannot generate enough energy, and this is one of the things that we see with aging. With aging, what happens that our body slowly starts shutting down because of decreased ATP production, and one of the keys in reversing aging is enhancement of mitochondrial function, and this can be achieved by glutathione, by restoring the glutathione pools in our body. And we also saw how many people suffered from chronic fatigue syndrome, and this was also because of decreased generation of ATP and mitochondrial dysfunction. So glutathione will help you to recover quickly and recover from the side effects of the long-standing case of COVID infection. Glutathione also has antiviral properties. See, when you get infection, it is the viral load that's more important. The greater the viral load, the more the chance of it becoming serious for you. And to decrease the viral load, what our body does, it inhibits the replication of the cells, viral cells. And glutathione has that property. It inhibits the replication of the viral cells and decreases the viral load. And thereby it will inhibit what? Cytokine storm, which is an exaggerated inflammation and immune response of your body, and that can be very, very fatal for you, cytokine storm. So glutathione has that property, and it can also cause, it has also anticoagulant property. So we saw with COVID infection is that people suffer from coagulopathy. There was increased incidence of clotting, and glutathione deficiency increases the activation of a factor, von Willebrand factor, and that can increase coagulopathy. Also with vaccine, we are seeing that there is increased risk of clot formation. So if you have glutathione deficiency, you are more likely to get side effect from COVID infection as well as from vaccine also. So make sure your body has optimal level of glutathione. Now, how your body can be deficient in glutathione? It can be either your body is not making enough glutathione, or there is increased depletion of glutathione. So as we age, there is decreased biosynthesis. Our body produces less of glutathione, and that's why our cell become more susceptible to oxidative stress and death. Then sex. So males have less level of reduced glutathione, and thereby they are more prone to get serious problems. And we saw with this thing COVID that male actually suffered more and died more when compared to female, and this can be attributed to glutathione deficiency. Diet. So if you consume less protein, if you do not consume enough fruits and vegetables, what can happen that your body cannot make glutathione in optimal level. See, glutathione is what? It's a combination of amino acid, cysteine, glycine, glutamate. So you need to consume high quality protein in order to make glutathione. You also need to consume some fruits, vegetables, and that will help you to make optimal level of glutathione. And you have to prevent this depletion. So comorbidity, if you have any type of medical condition, then there is increased depletion of glutathione. And we saw that people who are senior citizens were more likely to die of COVID infection. People who had comorbidity were more likely to die of COVID infection. And the missing link here is glutathione. Then smoking. So smokers also had increased risk of death from COVID infection, because when you smoke, there is increased depletion of glutathione. And chronic stress. Stress also depletes glutathione. So how you will know that you have less level of reduced glutathione? See, a rough estimate, you can do a rough estimate by checking your vitamin D level. It may not be 100% true, but it gives you a rough idea that you might be having less glutathione, because it is seen that reduced glutathione positively correlates with active vitamin D. And when L-cysteine supplement, which is a rate limiting precursor for glutathione synthesis, it's given as a supplement, it causes increased in reduced glutathione, and the mechanism is by upregulation of vitamin D binding protein, vitamin D25 hydroxylase and vitamin D receptors. So L-cysteine improved your vitamin D level. It caused upregulation of vitamin D receptors and vitamin D binding protein. As a result of that, there was improvement in vitamin D level also. So by knowing your vitamin D level, you can actually estimate glutathione. So this is a very rough way, but it gives you an important clue. So if you have vitamin D deficiency or vitamin D insufficiency, what you should be doing is, besides the supplement of vitamin D, you should also consume a high protein diet, so that your body starts to make glutathione. High protein diet, that's very important, and that's what is recommended for people who are recovering from this infection, a high protein diet. You also need to take N-acetyl cysteine plus glycine as a supplement, at least for 6 months period, and that is likely to replenish the stores of reduced glutathione. Because if your reduced glutathione decreases, it's going to cause imbalance of the redox homeostasis, and the shift will be towards oxidative damage. So make sure that you have optimal level of glutathione in order to stay healthy, reverse aging, and decrease the chance of dying from COVID infection or any other viral infection. And this is a great way to prevent a lot of medical condition also.